So as you may know, type 2 diabetes is very common, and there's a lot of really unpleasant complications that can come from it. I'm a PA and I work in the emergency room, so I see a lot of this stuff. Once it gets really bad, and people come into the emergency room with all these crazy complications. So today I'm going to share 5 of the worst complications from diabetes and how fasting can help you prevent those things. All right, so the first one that I'm going to mention is kidney failure. So a lot of people these days have chronic kidney disease, which means their kidney function, if it starts at 100% here, is kind of gradually going down closer to 0. And so there are various stages of that. And the most common causes of kidney failure are diabetes and high blood pressure. I believe those are number 1 and number 2 in some order. Probably diabetes is first. So people with diabetes are way more likely to get kidney failure. And then why do they show up at the ER? Well, various reasons. They could show up just because their kidneys are not functioning as well. Like maybe their doctor sends them in after doing a blood test. And so we're going to try to figure out, if we can kind of prevent it from getting worse in the short term and things like that. Or they could show up because they're having a bunch of swelling in their body. Because if your kidneys aren't working, maybe you're not able to, pee out the extra water, and so you get all swollen. Or maybe they're on dialysis, and then they have some complication related to dialysis or missing a dialysis or something like that. So a lot of those people show up at the ER. Now, the thing about kidney failure is once it gets to the end and you have to be on dialysis, that means you have to spend several hours a day, about 3 days a week, getting dialysis. And not only that, you're way more likely to die once you're on dialysis, just statistically speaking, because there's all these different weird things happening in your body. Things aren't working as well anymore. So kidney failure is a really unpleasant, really problematic complication of diabetes. So the second complication I wanted to mention is ketoacidosis. Now, this is a short-term issue, and it causes really severe dehydration. Ketoacidosis is mainly in type 1 diabetes, but there's a similar syndrome in type 2. So either way, you can get the same kind of complication. So this is just when things get a little out of control. Blood sugar's too high, generally the insulin's too low, or there's inadequate insulin at that moment. And then the person gets really dehydrated because there's just all this extra blood sugar. And so it's like if you had a glass of water and you just pour in tons of salt. You just keep pouring in more salt. Well, in this case, the sugar is the salt. And so it's like your bloodstream has all this extra sugar, and then you're also peeing out a lot of it, to try to get rid of it. But then the water's going out as well. So they get super dehydrated, and they also have, too acidic of blood, basically. So people show up like this kind of regularly. They'll have a lot of different symptoms, breathing issues, stomach pain, this, that, the other. And then you do the test and you see if they're in ketoacidosis. And then those people usually have to go to the critical care unit or intensive care unit because it's very life-threatening. So it's a very dangerous complication. Like I said, it's more of a short-term complication, but it's very dangerous. So that's number 2. Number 3 on the list is foot infections. So I spent some time in podiatry school before I went to PA school. And so I got exposed to a lot of diabetic foot ulcers. And I also see them in the ER nowadays as well. And so people come in they'll have this hole in their foot, basically. Sometimes it's deep, sometimes it's not as deep, and maybe there's a lot of swelling, redness, and sometimes pain, depending on how much, if they have sensation in their feet, because they often lose sensation as well. So these diabetic foot ulcers and infections are really unpleasant because basically you can't walk on your foot normally anymore. You might have a lot of pain. Then you have to go get it debrided, which means having somebody kind of cut off the edges every so often. And then it can get really bad and the infection can spread, and then you can lose your whole foot or worse. And that leads me to the 4th complication, which is amputations. So people with diabetes, unfortunately, very frequently end up with amputations. So it could be just their toe or half their foot or their whole foot or half their leg. So obviously that's not a very pleasant thing and can have a dramatic impact on quality of life. And then, there's other like downstream, effects that people that have amputations have higher risks of other complications and death and this and that. I don't remember all the statistics exactly, but it's definitely not a good sign if you're having amputations, because that means that you probably either don't have very good blood flow or your immune system's not working very well, or both. So it's, just kind of a sign of badness to come. So the fifth complication I wanted to mention is blindness or vision loss. So blindness, either way you want to look at it, vision loss, blindness. Diabetes is well known to cause various effects on vision, and sometimes it makes people go blind. So I won't get into all the nitty-gritty details, but if you have diabetes, that's one of the things you have to keep an eye on. And so obviously you want to prevent that. So all these complications that I've mentioned can potentially be prevented, at least in a large percentage of cases, through fasting. And of course, other lifestyle changes can help, be that avoiding processed food, certain types of exercise, improving your sleep, lowering your stress level. All those things make a big difference. But fasting is a really effective treatment for type 2 diabetes, because what causes type 2 diabetes? High insulin and high blood sugar. And fasting is really good at lowering insulin and lowering blood sugar and kind of bringing them back into the normal range. It doesn't happen overnight necessarily. It can take some months to really get things kind of moving in the right direction or under control, but it's a really effective treatment. So it's a way that you can potentially prevent most or potentially any of these complications. One other diabetes complication that you might not think of as a diabetes complication, but it certainly can be, is heart attacks. Because if you have type 2 diabetes, you're a lot more likely to get a heart attack. So I have a video right here that explains 3 ways that fasting can help prevent heart attacks. So that's related to 3 different things that increase your risk of heart attacks. One of them is diabetes, but there are 2 others as well. So you can watch that video right here. Thanks for watching, and I'll see you next time.